Go.
Hello, everyone. Good evening. Welcome to the third awareness talk on vestibular disorders and vertigo. Myself, Dr. Suman Narayan Swami, will be taking you through how the vestibular testing will happen and what are the procedures, what are the myths, what are actual facts about vertigo evaluations and everything. Before knowing all those things, I want everyone to understand one thing. Why is vertigo evaluation not so popular? First thing. Second thing is what actually vertigo evaluation means. In last two awareness talks, we spoke about how and what is vertigo, what causes vertigo, and all those things. Just to brush up on that, I'll just have this slide in for you all, where if you can see the left corner of the uh, slide, where you can see the ear of a person, and you can see a tiny structure in a blue thing here. There is some rings and there is one snail like structure which is called our inner ear. We always thought ear is to hear the sound, nothing else, but there's a lot of things what the ear does. If I can just magnify this small image into this large image, you can see there are three rings, there are small dots here. Those are called vestibular end organs or a sensory end organs for our balance. This information is spread across all over the body. From there, it goes to the brain stem, then it goes all the way till your legs, all the way to your cerebellum, that is your small brain, you call it in a layman term. Then it goes to your eye, that is vision, and then all the way to your brain. This is two-way communication from brain to brainstem and brainstem to your other parts. It's a two-way communication. Now you know what vestibular system is and what are the connections it has. Now just imagine I do a blood test or I do a MRI. I do a blood test, I get to know what are the compositions in the blood, what is the normal range I know, so I can compare, okay, this is less, this is more, or this is affected, this is not affected. I do an MRI. So MRI tells me the exact any structural deformities in the brain, if there is any kind of clot or a tumor or there is any disrupt of the blood flow, all those things can be visualized on an MRI. But just imagine the small, tiny part, and it has a lot of connections from the toe till the brain with neurons and other things. If there is anything wrong on this path other than structural deformities, that means this small inner ear, if at all, if it is giving a default information, that means not a correct information to this pathway, then the entire balance is affected. So I will tell you few examples what the patient comes with the complaint of. They tell, sir, whenever I go to lying down position, the entire room spins and it spins for only 1 minute and then it keeps, I mean, after that, I'll be completely all right. Sir, when I'm walking, I will be pulled towards one side, either in the left side or right side. Sir, whenever I'm just driving and then suddenly stop the car, I feel really dizzy for 10 seconds. Whenever I move my head from right to left or left to right, I feel my vision is blurred. I can't see exactly what is happening for 2, 3 seconds. Why is this all happening? Because the information from your inner ear is corrupted, or it is not a good information which is reaching your eye. Because of that, you may have a blurring sensation when you move your head. When you lie down, you get your chakkar or giddiness. That is again because the information about your lying down position is wrongly interpreted to your brain. Or when you're walking, you will be pulled towards one side. That is because again the inner ear not giving information, correct information to your legs and this pathway. That's why you feel that you are being pulled towards one side. Why it does not give you a good information? Because it is having some damage. Maybe this rings having some damage, or the small structures here has some damage, or the fluid inside has some imbalance, or the information coming from this inner ear to the brainstem through the nerve, vestibular nerve or a vestibular ganglion may have some problem. For said reasons, you don't get a good information from your inner ear to your entire brain region or to your body. That's why you have all the symptoms. Now, we know this information is not going right to your brain or a brain structures or a body parts. That's why you have vertigo or giddiness or imbalance. Now, I told you the information goes to your eye. That means eye is very important. So eye can give us some information about the vestibular end organs because the information is going to eye, right? So I told information is all the way going to your brain and also from brain to your brainstem and to your eyes. So the information coming from brain to this vestibular sensory or vestibular nuclei at the brainstem and going to your eye. There is a connection. So this connections, if we check, we get to know what is wrong with your vestibular system. Second point. Third point, all the way from this small vestibular system, it goes till the toe. That means for your postural balance. So you are standing straight on a flat surface or on a say soft surface or not on an uneven surface. So all this information can be checked if I evaluate the posture. So all these three information together, if I gather, I get a good idea about what is happening to your vestibular information coming in, whether it is a faulty information because of that I'm losing balance, or it is good, there is some other cause for whatever is happening. One more thing I told, whenever I move my head, my vision gets blurred. That means whenever you move your head, your vision is not able to capture that object with the head movement. So for few seconds, you will have some blurring. After that, it will be fine. So I need to check that also. Whenever I move your head, whether you are able to understand or tell me whatever the words are there in front of you. So, with gathering all this information, I will take you through few videos how my eyes are giving me information about different conditions. So, just for understanding what is happening to your eye or what am I going to get from the eye movement. If you can just see, this is a head orientation of a person. Just imagine if he goes to a lying down position like this and look at the eye. Usually, eye should not start moving. So that eyes are dancing like anything. It is just rotating and dancing. Just imagine if your eye starts dancing or rotating like this, the entire room spins. The entire room spins. After a few seconds, it is all normal. Don't you think our eyes gave you some information about what is happening when the patient is lying down? Definitely, yes. Let me see another example of what is happening. This is one more patient where he lie down on a different position and see now it is not rotating. It is moving sideways. You see that? It is moving sideways. So I get to know there is something wrong with the head position and the eye position. There's some information which is going wrong to the eye. That's why it is moving like that. So I got a good information about the eye. I show you another video. Again, if I go straight back, what happens to my eyes? Now you see it is coming down. So first video it was going up and rotatory. Second video it was going sideways. Now you see it is coming downways. Simple, some more examples we will see. Now you see it was moving this way. Now it is moving in an opposite direction. Yes. When I move my head towards the other side, again it starts moving very badly. So this is all involuntary. This is not some patient is doing. This is all involuntary. Now I know there's lot of information where I can get from an eye movement. So when we talk about vestibular test, so eye recording or eye movement recording becomes a very, very important topic. So, just for you to understand, this is eye movement, and here there is a graph. There is some red line, blue line, and something black or something gray or brown. What is this recording is whatever is happening to the eye is being traced here. If it moves in the horizontal direction, the tracings are in one direction. If it is moves up and down, the tracings are in other direction. If it moves in an opposite direction, the tracings are in other directions. So in this, we have lot of tests, say spontaneous in dark, where we close the eye completely, where the patient cannot see anything. So you have an infrared cameras inside the goggles, where we place the goggles to the patient, and whatever is happening to your eye, we keep recording. Here we keep recordings of the eyes, as well as the eye recording will be depicted as a graph here. So high frequency HF, we shake the head, because I told you when you turn the head, you miss out some things. So I should know what is happening when I shake the head to the patient. So I do this. There's hyperventilation, where I make the patient breathe very hard, so that your oxygen, carbon dioxide becomes more. When there is that kind of challenge, if you have a minor dysfunction also, it will be picked up in our graphs. So this is one of the evaluation called video nystagmography. I have put very, very limited information on this, because there's lots of information what you get from video nystagmography. For you to understand what we do is very, very simple. We keep recording your eye movement on a particular task. Sometimes I may ask you to follow dot on a TV screen, where the dot goes one time towards the right and towards the left, or sometimes the dot goes slowly from right to left, or these kind of, I close the eye and do all the head movements and all those things, or I put this goggles and I make the patient lie down, turn the head to right side, left side, or hang behind, so that you get to know at which position what is happening to my eye. Because in the first awareness talk, we spoke about what all information your vestibular system can give you. This is one very, very important evaluation when it comes to vestibular testing. The second, I told you, the patient has to balance. If the patient has to balance the information from the toe to my vestibular system, or from vestibular system to the toe, should be completely perfect. So to evaluate that, there is something called posturography, where there is a platform, where the patient will be standing on this platform. As in when the patient moves left or right or front, back, or he puts more pressure on the right side or a left side, the graphs keep accumulating information about what the patient is doing. Then we put a foam pad on this platform and make the patient stand on the foam pad, where complete sensory information from your legs is being taken out, so that he has to only rely on your inner ear balance system, where in that, if he has any kind of problem, you can see here vestibular scores being 46, or somatosensory, that means the information from the sensory system of your legs being 100%. We can easily find out whether it is from the, because the patient is not having strength in his leg, or because he is not being able to use his inner ear information. So this is one of the other test, which is again very, very important in when it comes to vestibular evaluation, that is called posturography. The third evaluation, which is again very, very important, I told you that time. I'll just go back to my previous slides. This slide, you can see this rings here. I have spoken about this rings in previous talks also. This rings is going to give the information to the eye, whether my head is moving in this direction, or this direction, or this direction, or this direction. So only these rings will give you information about which angle your head is moving. Because that information is very important, because when you're walking, your head will keep moving. When you're walking, you can read a board, or you can read some text when you're walking. That is only because as and when the head is moving, your eye is actually correcting to that head movement only because of these rings. If these rings information is lost, whenever you are moving, you keep seeing everything up and down, up and down, up and down, something like this, like this. Okay. So if I need to evaluate that rings, so I'll have to stimulate each ring separately. So I told you I have three rings on my right, I have three rings on my left. Just imagine if I turn my head towards right side, this one of the rings that is in horizontal plane will get activated, and my eyes move to fixate on one of the intended object. Now when I turn my head and my eye do not come to that intended object, I will lose that image for 2 or 3 seconds, right? That is what these tests will do. We have a sensor which will be strapped to your head, and there'll be a TV screen where as soon as I move my head, there will be some image which comes, or a letter which comes on the TV screen, where the patient has to identify. Very, very simple, no pain, nothing. You just put a strap, you turn, you see. Okay, so like that, each ring I stimulate separately and get to know the information about how much he can tell correctly. Anything more than 8 letters, if he can identify out of 10 trials, that is normal. In this patient, this is one of the patient's report where the left side scores are reduced. That means his left, that two rings which is affected, he is not able to tell that letters. Okay. Now, why I need to know all this information before treating or rehabilitating this patient? Because post rehab, you can just see here these two rings, which he didn't have any information. Post treatment with medical treatment or rehabilitation, you can see the scores have become completely normal. This is actual patient report itself. I'll show you one more thing. I showed you the vestibular scores on the platform where the patient has to stand with eyes closed, cushion surface, and all those things I told you, where it showed 54 as a score. After say 15, 20 sessions of rehab, you can see the patient score is 88. That means you can actually track the improvement as well when you do this kind of test. Now, you got to know fair idea about what vestibular test is and what we do in vestibular test and all those things. We will go, and these things you're actually always have this doubt. Vestibular tests are painful. Now, I explained you about the vestibular test till now. Do you think it is painful? Definitely not. It is safe, gentle, nothing we will have invasive techniques. Everything from externally, we keep recording about your eye movement, head movements, and your posture when you stand on a surface, what happens to your body balance. That's what we do. So it is not painful, it is very, very safe. Dizziness is caused only by low BP or anxiety. Definitely not, because you got to know about what is vertigo and what is dizziness now, and how important is our inner ear and the inner ear connection. So, most commonest cause for a vertigo or a dizziness is your inner ear. So, you can even tell maybe 75% to 80% of your vertigo and dizziness is because of your inner ear. Only older adults lose balance? Definitely not. These kind of balance issues or vertigo can also be seen in children, even children younger than say 2 years, 3 years. People have even been evaluating this vertigo or inner ear issues with which is related to balance or vertigo, even in 1 year old, 2 year old babies. The world is so fast and so advanced now. Vestibular problems cannot be treated. No, I showed you a live example of two patients where they came with a problem with vestibular disorders, and with rehabilitation and medical treatment, completely they improved. This is only after 10 or 15 sessions reports what I'm showing. Definitely they would reach 100% of accuracy post uh, finishing the course of rehabilitation. Vestibular tests are only for severe dizziness? Definitely not. Even minor problem with your inner ear or the nerve or the connections can cause any kind of motion sensitivity, and which is requiring your testing. Why we tell this mild imbalance or mild motion sensitivity requires evaluation is because the problem may be very, very small, but this problem should not lead to a major problem like you had a fall, you had a hip injury or a hand fracture or something like that. Basically, we don't want you to go to that severe damage. Thank you. These are the information what I wanted to share. But now we'll take a few questions which is there on my chat box. What are the red flags to watch out for vertigo? Asked by Shabnam. Uh, what are the red flags is basically when you walk, you are being pulled towards one side, first thing. Second thing is when you lie down or get up, you get completely spinning sensation. Second thing, whenever you turn your head right or left, you feel blurred of the image for fraction of seconds. Third thing. Fourth thing is when you're sitting for a long time, like say 10 minutes or something, and then you suddenly get up, you feel imbalance for 5 to 10 seconds. Those are the red flags to be watched. Or is there any kind of inner ear ringing sound in your ear, one ear, say left or right, without any external sound, you start having a ringing sound? That is also one of the red flags. Or sudden hearing loss also can be considered. Bhairavi, practical things to do, balancing and regaining confidence when we have vertigo. Practically, you start moving very slowly, not quick movements. Get to regain your confidence, get your evaluations done. Based on that, you will get to know what is exactly happening to your balance system. Is there any other cause other than inner ear? So these two things can definitely regain your confidence. There's one more person. I am not able to get his name. How does ear health play a role in vertigo and steps to maintain good ear health? Definitely, because balance system as well as your ear system are together. So your good hearing health also will definitely help your balance system. So what is good ear health? Any kind of cold, first visit an ENT to get rid of the cold. Don't prolong it, and then don't spread that infection to your middle ear. Any kind of ear infections, please visit a doctor immediately so that it will not worsen your ear conditions much. Third thing is loud noise, please avoid. And don't use anything to your ears, external objects. There's one more question by Apurva. Is this age related, or can anyone get this irrespective of age? It is not age related. It can be anyone who can be affected. And we are happy to announce that Optima Hospital, we will have vertigo evaluation facilities. So you can all definitely reach out to us anytime for vertigo evaluations at Optima Rajajinagar or Mahalakshmi Layout. Is there anything any other questions? I'll just see if there is any other questions. Okay, let me just talk to you about uh, two patients whom we have recently seen. One patient is a butcher. I don't know if I've shared it. She's a butcher, basically from not from this state, from Tamil Nadu, who had vertigo of whenever she sleeps, lies down, getting up, turning over in the bed, and all those things. And then she has visited almost uh, more than 20, 30 hospitals for this problem, and no one were able to evaluate and tell this what is the diagnosis. And then they were always prescribing some kind of medications, and then she used to go, and never this vertigo was cured. That is only because you have not actually evaluated and told what is exactly the problem. See, inner ear problems can be several. So it can be an infection, it can be just a condition where some particles move from one place to other place. It can be an inflammation, it can be a tumor, it can be anything. So only after proper evaluation from our side, we were treated with a repositioning maneuver for her, and then she was completely symptom free within 1 or 2 days. So these are the conditions where we need to. Why I'm telling you, why I'm stressing you on vestibular evaluation is because in an MRI, see, ear inflammation, or if there is any kind of, say, particles moving in your small inner ear, in an MRI or a blood test cannot tell you that, okay, there are some particles moving in. If there is a fracture, yes, your CT scan or X-ray can tell you there is a fracture. If there is any kind of bleed, yes, your MRI can tell you there is a bleed. It is not like that. So vertigo or a vestibular evaluation is basically a functional thing where the function of your inner ear is malfunctioned. So basically, that is why your other MRIs or blood test or any other kind of evaluations will not pick up what is wrong with your inner ear. Just checking if there are any more questions. And you have to, one more thing, remember, very, very important is any kind of hearing loss, sudden hearing loss in right side or a left side. You have sudden hearing loss from today, suddenly it got blocked, or on a long run, one side I'm not able to hear, but the other side is much, much better. If there is any kind of asymmetry between both the ears, that one side is better than the other side. If there is any kind of ringing sensation in your ears, there's a continuous ringing sound in your ears, one side or both the side, you need to be very, very careful and first reach out to other doctors to get evaluated, because those are the signs of little serious conditions at times. So not always, but at times it can be a serious conditions also.
Dr.
A
Krishna
norm, yeah.
is asking how much time testing takes.
Okay, Krishna, how much time testing? It for the complete vestibular battery, it takes somewhere between 1.5 hours to 2 hours, because there are certain tests which we need to say, for example, postural test. We need to make you stand on certain surfaces and all those things. So that takes around half an hour. The other VNG, because in detail we may have to go, that may take around 1 hour. The other test combinedly, it may take another half an hour. So somewhere between 1.5 hours to 2 hours will be the complete evaluation of your balance system.
Okay, doctor, thanks for your
Okay,
time.
thank you so much. Is there any information if you want regarding vertigo and vertigo evaluation? You can reach to Optima Hospitals, super specialty hospitals, Mahalakshmi Layout. Thank you so much.